So thank you very much. Yeah, I'm really honored to be here and share this little piece of work I made with all my colleagues and people all around the world. I've made something related to senior channels since I am Western doctor. I specialize in physical medicine and rehabilitation, and of course also I have been studying acupuncture basically for a lot of time. And I found this topic, Sinicelli, really fascinating. I've heard a lot of beautiful presentations during this congress talking about bringing our treatments to earth, making things reliable, real, understandable for students and for patients. And I think that, yes, sometimes in the West we have had a tendency to interpret maybe the ancient reading always with this mystical and etherical appeal, which of course is something that's really fascinating about Chinese medicine. The philosophy behind it is really deep and profound, and yet we need, yes, as a doctor to be able to communicate with other doctors that are not so into Chinese medicine, so in love with it as us, and also to patients that basically in Italy do nothing about this. So I think senior channel is a nice topic because when you read the text, I think that they were already on earth. I think that the reality they were looking at was basically the same. And it's amazing how more than 2,500-year-old book contains so much accurate anatomical information that with the modern theory, fascial approach, are being discovered to be consistent and true and reliable and also effective in treating ailments. And so I told my goal was to maybe stick to the classic text. So I tried to read. It's just only at one chapter, so it's basically easy to go in depth. And reading the 13th chapter of the Ling Shu, you can of course have a good translation from Unshu. That's the text that we choose for our work, and then try to read and really try to understand the description they made about this senior channel. And focusing especially on the hand sinew channels, because of course it was too big work to do just in one time for the Congress to expose all the 12 channels, but we focus on that, and then trying to read this text critically. And of course also pairing this kind of approach to the real anatomical dissection that have been made by physicians around the world, and especially the work of Pony Chan, which is a doctor that I'm in touch with, and that actually made the same thing. He read a book and then tried to dissect muscle by muscle, understanding which muscle is consistent according to anatomical fascial continuity with the description made by the Ling Shu. And so trying also to interpret something that we'll go through in the next slide, more related to the head part of the sinew channel, where you can find an anatomical structure that can be overimposed on this pathway. Then you can start to look at the cranial nerves and other structure that really can be part of this description. And we see this theory is not only a theoretical one, but is supported also by the description of syndromes that you can find inside the Ling Shu. When you see something is broken, this happens, and so you can start to look as they were really practical in their approach, and they will really seeing ill people with real illness. And it's amazing. We don't know exactly from where they get all this accuracy, anatomical based perspective, but I think it's already inside the book. And so we think it is a way to honor this tradition, to try to make this work, and of course to make something personal about it. And so since I also love drawing, I love martial art, I draw myself these kind of pictures to bring also an artistical flavor to the work. And so that's our work. I've been able to work also with other my colleagues. Silvia is here, is the one that made the digital version, which I'm not so good at, and made all the coloring. So it has been a pleasure to work with her, and now we are exposing this poster. You have seen it in the hall. And its features are basically the assignment of muscles, real muscle, to the sinew channel that are based on real fascial connection, and an accurate study of the Ling Shu, and the description, of course, of pathological syndromes and the dissection made by Pony Chan. And of course, we have some cranial nerve to complete the pathway when it's not possible to assign a real muscular structure to the pathway. So we have, for example, the trigeminal nerve, the fifth nerve, which goes well along the Yanming. Of course, it's a channel always involved with tooth problems, with pain in the face, and also we'll see some, muscle described there, interacting. It's really interesting. It's the only channel that maybe goes across the head, that goes from one side to another, and it's, it's funny to try to figure out what they were thinking, because they only describe things that goes one side, and this time they say this goes also on the other side. One may think that maybe the muscle involved in maybe mastication or while speaking always move together. So it's difficult to activate just one part of your face. When you talk, you move, you speak. So this can be one of that kind of, intuition they had. And this thing also is real for the Shaoyang, when we see the 12th hypoglossal nerve. You see when they describe this kind of illness, they say when there is a trauma or damage, you see the tongue is curved, so it turns on just on one side. And this is really consistent with what happens when you damage this kind of nerve. You can imagine maybe they live in difficult times, they got war, they got things, some crazy things can happen in that time, and so maybe it can be that maybe an injury to a part of the body led to the observation of some clinical changes, and they try to figure out what could have been damaged. And so you see muscle don't move, so this pertains to the tendinal sinew channels. They could talk like this. And also, for example, when you have a description of painful paracousia, which is some pain that you feel when you hear noises, this can be also something led to the seventh cranial nerve. There's a branch of it that goes inside the ear that regulates also the tympan membrane. So when it's not well regulated, it can cause your ear not to adapt correctly to the sound, so you feel it painful. So there are a lot. Or for example, when we describe the yang min, language and test in the course, you see in its description is when this is injured, you can raise the shoulder or turn the head around. And this also is a clinical feature that if you study peripheral anatomy, you see when you have spinal accessory nerve impairment or injury. That's exactly what happens. The trapezius can raise, the sternocleidomastoid can turn their head. So maybe this is a presentation which is really consistent with an anatomical real channel. So as we say, we try to interpret things as as modern people, and of course knowing nothing about it's difficult to find an accurate translation, because usually you need both linguistic competence and also a clinical eye to understand what a doctor is talking about. So it's not easy always to have all this information come together. I think this is a nice field to explore, and I think it can bring maybe more confidence also to therapists, because relying on a 2,000-old-year books is not always the best evidence-based clinical updated practice you can propose to patients. But I think that some information were really precious, and so this can I hope this work is a step further in giving this kind of confidence to patients, and maybe some also relief to patients. Okay, so thank you.